Good afternoon and welcome to the Festival of Urbanism, Making Better Places. We're doing our first CPC lunchtime talk. The topic is public health planning and pandemics. So before we start, I'd like to acknowledge the traditional owners of the land from which I'm zooming, the Gadigal of the Eora Nation, and I pay my respects to elders past and present. And this land was never ceded, it always has been and always will be Aboriginal land. We're very lucky to have with us this afternoon Dr. Patrick Harris. He's the Deputy Director for the Centre of Health, Equity, Training, Research and Evaluation from UNSW. So Patrick, welcome and thanks for joining us.
That's all right, thanks.
So I understand you've been working on two pieces of work which are linked to the festival theme, Making Better Places. Can you tell us a bit about your project that compared the responses to COVID-19 across 4 global cities?
Yeah, so back right at the start of the pandemic, I was contacted by a colleague of mine called Ben Kay from the UK, and the journal Cities and Health had put out a call for, like a lot of journals at the time, put out a call for insight into the pandemic, and particularly with a cities focus, cities and health focus. So Ben contacted me, and then we involved another colleague of mine from Italy, who lives in Denmark, which is Italian, Francesca Vigliani, and also another colleague who's a PhD student at UNSW in my centre, Jin-Hee Kim. And it was interesting at the time because there wasn't a lot of data out there. So what we did was we sort of got together and thought, well, what are we going to do? We thought we'd compare all the cities we were involved in. So it was London, Seoul, Sydney, and Milan, I think. And we decided that we'd take I was writing a book at the time on sort of urban planning and health stuff, and I was really getting into the work of Neil Brenner about multi-scalar approaches to urbanism. And what we decided is that the pandemic's a really good example of what happens at a multi-scalar approach to thinking about health. So it started in a wet market in China, went through sort of cities and regions, through individuals and their contacts, down into people's lives, into their local neighborhoods, into their homes, and also even through their bodies. And what was interesting is you could really see that kind of multi-scalar approach really helps to understand how the virus is first transmitted, but also then what the response of cities can be.
And how did those cities support their populations in response to COVID?
It's interesting because the city sort of dynamic in a policy sense was that it's really about responding to lockdowns and also the idea of social isolation that we were all subjected to around that time. So what we found the cities were doing is that they mobilized local resources and networks. So I think it was Milan at the time developed a mutual aid fund to support at-risk people and give them opportunity, employment initiatives, and also things like provide food vouchers and so forth. Also supporting vulnerable populations is really important. So you'll have heard of the work in Haymarket around housing homeless people in Sydney. That was a similar thing happened in London. And then also really helping businesses keep functioning and going off the ground, getting off the ground. So we found in Sydney and also in Seoul, there was quite a lot of rent relief for businesses, but also small grants for businesses. Overall, it was interesting that the kind of cities are the point where, in the Australian context, so you've got grants, etc., coming through from the federal government. Cities are the place where you can actually apply for them and then get the money that you need to support your activities in the face of the virus. You were going to ask about lessons.
Yes. What are some of the lessons from those comparisons? And
obviously we haven't rehearsed this.
Yeah.
So we're just trying to work our way through it. Yeah.
So those 4 cities, was there any comparison that sort of jumped out to you? Were some cities doing something particularly different, or were we all sort of along the same pages?
Actually, what we found across the cities is that there are real similarities in like sort of positives and negatives. So in terms of the positives, the recognition that cities are at the front line is really important. So, and that, it comes through for everything from recognizing that, sort of our connection through cities, through air travel and globalization is fundamental to the spread of the virus. So in Australia, we're pretty well positioned because we can close borders more easily than, say, Europe. But as part of that, so cities like Milan were forced to go into lockdown. Originally, Milan didn't want to go into lockdown, but then they were forced to because they realized that they were going to spread from Milan to all over different sort of urban regions. So they had to go into lockdown, which was a positive. And overall, you can see positively that it's really a strong public health response in the face of lockdowns and social isolation when it's mixed with things like testing and tracing, and they're fundamental to keep the population, the prevalence low in the population, to then go off and do more contact tracing so that the capacity to do that's not overwhelmed. And cities all have a role in helping that happen. And you'll find that in a lot of countries where the virus has blown out, it's been that sort of lack of ability to keep the lid on the population prevalence that's the real problem. And we're lucky in Australia we don't have that problem. More negatively, you know, really local things like home isolation, they're problematic from an urban inequity point of view. So some of us can more easily live and work at home, but other people don't have that opportunity. So particularly people who are forced to work outside of the home, and that brings with it, you know, isolation brings with it things like mental health issues, but also risks of domestic violence, all those additional stresses for people. And then finally, the real problem that it brought into light was the failure of this sort of model of privatization and small government. So again, in Australia, we're really lucky that we've had strong investment in public health capacity to keep a lid on things like viruses and pandemics. And that's come to play. I mean, that's really, really the case. You can see that the fact that we've got good public health capacity to respond has been the reason why we've been so successful at keeping a lid on it. Other places that aren't like that at all, there's been a disinvestment in public services, particularly in the UK. You can see that, and that's been really problematic. And again, things like aged care have been a problem all over the world, where there's been a sort of privatised model and not much regulation, and it's been really challenging to keep a lid on the virus in those contexts.
And so is this an ongoing project? Are you still tracking the data?
So we've finished that particular paper, and now I'm part of lucky enough, since that time, I'm part of a consortium of lots of different universities. So through the Healthy Urban Environments Collaborative, and which Sydney Uni is not involved in, sadly, Peter. But there's UTS, there's UNSW, and University of Western Sydney, and 2 local health districts. And we've just completed we're about to try and publish a rapid review of the literature on the history of respiratory pandemics in all over the world. So we've gone all the way back through to the 1918 to 20 Spanish flu. And what's really interesting is that you can see that there's historically quite a clear way of dealing with pandemics that I think in some ways, some contexts around the world have kind of ignored for political reasons. And those are, you know, things like lockdowns, closing public spaces, making sure you keep testing and tracing, mask wearing and so forth. And they do have historical precedent, which I think in Australia, we've kind of followed those lines, but in other contexts, not so much.
And so you've looked at cities and comparing the history of pandemics. What do you think the role of public planning has in managing pandemics, and do you think it has a bigger role in general around public health? So
I think urban planning is really interesting because urban planning came out of pandemics and public health.
Right.
I think what's interesting is what we've found is that there's a dual role. This definitely does have a role, but there's a dual role. For one is facilitating preventing pandemics from occurring or spreading, but then also there's a response role, and I'll talk about both of those. So in a prevention kind of role, in Australia, we've got really good core public health focused interventions. So everything from closing borders, locking down to bring numbers down, and testing and contact tracing. And planning helps across all those things. So from stopping city to city spread, helping with lockdowns, facilitating social distancing by redesigning public spaces. And I'll talk more about that in relation to density in a second. But also things like maintaining core infrastructure like water and transport. There was a really interesting piece of work done in Ohio about preparing water infrastructure in relation to pandemics, really because of staff shortages. And there was like if you there were lots of people being off work sick, then there's no one to man the water infrastructure, and you need to put plans in place for that. But also we found things like because we were looking at design, we looked at things like down to internal design of buildings to improve ventilation, both in the building and external to the building. So there's a whole heap of things that planning can do alongside those core public health functions. But then moving away from that, there's also a responding issue, so a responding role for planning. So, if you're thinking about the economic and social responses to the problem of the pandemic, planning and infrastructure have a critical role in helping us move forward as a society into the brave new world that wherever we're going next. Thinking about population growth, planning is all about population growth. That's ground to a halt. We can't rely on the same drivers for the economy through single dominant urban centres or CBDs. So, I think Rob Stokes was on in the news, the planning minister in New South Wales, talking about how the sort of shift from in the face of the pandemic is supporting concepts like the 20-minute city and these smaller urban spaces and places that we can more easily access and while we're working from home, etc. But what we really need is to plan and design for spaces and places so they maximise movement while we're facilitating social distancing. So I was thinking of a good example of the challenges of doing this. I was shopping the other day so I drove to meet my family at a big shopping centre, went into the shopping centre. No one was wearing masks. There were hundreds of people in there. I had to get my shopping from the top floor, get a lift down. The lift said we've got a maximum of 4 people in the lift. There was about 40 people in the lift. And when there are the real risks still in Australia about the virus. And when you know those things are, the virus is out there, it's actually quite a terrifying experience. So I think that's a good example of how we still need to be really watching what we're doing in terms of an urban place and space design thing.
Yeah, and you mentioned just before about density. So New York City is quite badly hit by the pandemic, and there's a huge population density there. What do you think is that something Australia needs to be looking at or managing?
Density is clearly a factor. What we found was actually a bit more mixed than I thought it was going to be in terms of the literature. So there are 3 things. One is that there are some studies that said density is not the main factor.
Right. Okay.
It's actually connectivity between cities is the main factor. But then there are other studies that showed that actually density does really matter, particularly early on. And you can see in places like China, when they did very quick lockdowns in highly dense urban areas, it really was able to contain that city-to-city spread. And then the final thing that's really important is that there's a socioeconomic gradient to all this. So areas that are poorer, less well serviced, etc., are likely to be a greater risk, and that's over and above density, I think. And you can see that with the UK and some of the issues that are happening in the UK at the moment. I just wanted to in terms of density, what the main take home that we've got from the literature and from the knowledge of this area is that what we know about really good, healthy urban planning is also really good for preventing and responding to pandemics. So I'm fortunate enough to work down in the southwest Sydney. So I work for something called the Western Sydney Health Alliance, which is part of the Western Sydney City deal. And also as part of that, I work with some local governments who are putting together these fantastic master plans that are all about maximising open space, maximising movement in places and spaces, and creating really great spaces that we're not stuck in, and we want to use more, but we're also able to focus, even if they're dense, to get movement. And I think it's called movement in places that is the current sort of policy jargon about it. But all these things are known to help stop the spread of the virus and be really good for health and well-being. I think the challenge is that as we think about the future, is how do those kind of really good positive things like those master plans get implemented? And I think COVID is good as part of that conversation that we can have now to say, well, public health is core to planning, and planning is core to public health. How do we implement those things?
Well, thanks so much, Patrick. Super relevant work, and I look forward to reading more about what you're working on. And I just wanted to throw to the audience for some Q&A. In the webinar version of Zoom, there's a sort of Q&A panel, and everyone's welcome to pop in a question in there if you've got something you'd like to ask Patrick. I can see that we do have a question in there. If we want to, can we unmute Patrick? Oh, well, hopefully that was taken care of. Thank you very much. Brave new world of Zoom webinars, everyone. So if anyone has any questions, it'd be great for you to pop them in there. Patrick, is there anything you wanted to add about what you're currently, any nuggets of...
I think I've probably done enough. If I wasn't on mute, hopefully we've got enough nuggets of gold out there. I would like to say thank you to Peter and the Festival of Urbanism, and also the Henry Halloran Trust. It's been great. I've just come over from Sydney Uni, and the work that they do is fantastic, supporting young researchers in this space. That's good.
Great. Okay, we've got a couple of questions. Have nationalist governments had more issues adapting to the pandemic? And do you think health and planning are connected enough?
So what's a nationalist government?
Nationalist government.
While I'm talking about the other one, what's an example of a nationalist government? I'm not quite sure.
Okay.
But health and planning, no, not connected enough at all. It's interesting that there's a lot of work on this. If you read any like my work or Susan Thompson's or Jen Kent's or people like that, you can see that there's a historical connection between planning and health, which has been lost. And unfortunately, we've both become sort of siloed sectors where we're not engaging enough. So the work I was talking about down in Southwest Sydney is a really good example of how health and planning have come together to work together in terms of really big urban problems. And I think we're starting to move to see that happening in practice, which is good. So what was do we have a national?
Yeah, so national government. So I suppose they mean federal in comparison to state.
Oh yes, well I mean it's part of the sort of multi-scalar thinking about cities is that there's layers of national and then state and then down to local government. I think so. Well, national governments often, if you think about the Australian context, national governments don't really. The federal government doesn't have much to do with cities, and mainly its response to the pandemic is about more social issues and more economic issues. So. I can't see this with my glasses either, so I'm struggling here.
Have you seen examples of where health and planning have become engaged and worked well together? What were they? You might have referred to that a little bit, yeah. Do you think the pandemic will mean public health will be better funded?
Well, I don't want to get too political here, but you would like to think so, but and this is anecdotal, so I do need to check on this. We did try. I'm part of the Public Health Association. We were angling to get, I think, a much better public health budget within the medical and hospital budget. There's a difference between public health and public health as hospitals, and hospitals usually get all of our funding. But I don't think that played out, unfortunately. But I think what is important to realise is that public health has played a really important, critical role in the Australian context around the virus. Without that kind of funding, we'd find ourselves in all sorts of trouble, similar to other countries around the world.
So I think we've got time for one more question. There was one right at the bottom, if you could scroll, and I think it's time for me to get my eyes checked because I'm struggling too. Are you aware of and do you apply health in all, in all policies approach, and in particular, the average health status, health inequalities matrix for assessing impacts on population health?
So that's quite specific. Sort of. Anyone who's working in intersectoral work, so would be considered applying a health in all policies approach. I call it healthy public policy because that's got a stronger history to it than health in all policies, which can be anyway quite specific. So yeah, we do that, and it's all about the ability interest and ability of getting sectors to work together for the goal of improving health and well-being. So yes, we all do that, although we don't always call it health and all policies, which gets me in trouble sometimes, but it's true.
Great. Well, on that positive note, thank you so much, Patrick, for your time today and for sharing your work with us. I'm going to introduce our next speaker, and just before I do, just an open invitation to everyone out there to pop in your questions in the Q&A section as you think of them, and we'll come to them during the question time. So our next speaker is Dr. Emily Rugel, who is a visiting postdoctoral fellow at the Charles Perkins Centre, Westmead, the University of Sydney. As a postdoctoral fellow at Simon Fraser University in Vancouver, her work explores health promoting community design with the aim of developing evidence that can be embedded in sustainability plans and policies that advance equity. She firmly believes in the acquisition of knowledge through chance encounters as well as scientific investigation, which makes the CPC a great fit for Emily, because that's kind of what it's all about. If anyone's been to the Education and Research Hub on Camperdown campus, the building is set out sort of in a way where chance encounters are encouraged between researchers. So we have Emily joining us. She's in the studio just getting mic'd up. And hi, Emily.
Hi.
Welcome.
Thank you so much.
Thanks so much for joining us. So Emily's little section of today will be a little bit different, where she'll give us a bit of an overview of her work, and then we'll launch into a bit of a chat about what she's working on. Take it away, Emily.
Great, thanks. So I'd actually like to begin by returning to a time before the pandemic.
and thinking about the many ways in which both the physical form of cities and the psychological effects of that form have really not served the needs of children and youth. And there was a really interesting image that was posted on Twitter probably a week or two ago that looked at activity spaces across the generations. And they looked at just one family living in Dublin, and they compared how freely the grandmom, father, and 11-year-old were able to range. And the grandmom essentially had free range of all of Dublin. It's a huge circle. The father's movements were a bit more restricted, probably to his neighborhood and the surrounding neighborhoods. And then the 11-year-old was barely able to cross a street alone. And the things that I think are really relevant to this discussion of pandemics, planning, and public health that factor in that, of course, there's a huge range of factors, but are really the amount of our policy and plans that have focused on cars, and also this increasing loss of connection to the natural world, which is actually what my research mostly focuses on. So areas such as beaches and forests and bushland. And I think that it's really important that we keep these issues in mind as we move forward and look at the impacts of the pandemic. So just thinking back to the Melbourne lockdown and to lockdowns that occurred throughout the globe, many children went from that already very limited activity sphere of barely being able to cross the road, a 5-minute walk, to just the 4 walls of their home. And that's a home crowded with all of their other family members, however many they may be. And of course, as Peter mentioned, that has a lot of equity issues in it. And also a home that's absent of their friends and those really important social connections. Probably the harshest lockdown that we've seen in response to COVID-19 was across Spain, but particularly in Barcelona, where for a 6-week period, children weren't allowed to leave their homes at all. And they did slowly lift some restrictions after those 6 weeks. They were allowed to leave their home for 1 hour a day, go up to 1 kilometer, but that was only for younger children, so children under 14. And unfortunately, as COVID has reemerged in Europe, they've initiated new lockdowns there. But what I think is really great is that they did appear to learn some lessons from that first set. So in the latest lockdowns in across Spain, but particularly in Barcelona, they've left playgrounds open. There's a nighttime curfew, so they're only open until 8 p.m. And they're also returning to in-person schooling. In many ways, the Melbourne lockdown, even though it didn't last as long, it was even more restrictive, especially for residents of the 9 public housing towers that were locked down pretty much instantly. So they made the announcement in the afternoon and the restrictions were placed that evening, which meant that parents didn't even have enough time to get diapers, toys, supplies, baby formula for the youngest children. And they did try to remedy this. So I think there's kind of a classic feel-good story a few days later when they dropped off these activity boxes full of puzzles and Legos for the kids. But obviously, that's just not enough to offset some of the challenges of living in such restrictive circumstances. And I think this whole field of evidence, of course, is still emerging, right? Because we're still in the midst of the pandemic. But the research that we have from studies and kind of analyses conducted by health departments does show that this combination of online schooling, a lack of access to outdoor environments, and social isolation definitely has clear detrimental effects on the mental health, particularly of younger children. So there was a really interesting study conducted by Oxford with more than 10,000 parents and carers of young children. It looked just at the first month of lockdown across the UK, so just 1 month of time. And they surveyed both the parents and carers for younger children, and then they actually spoke with older children and adolescents themselves. And they found that just that 1 month was linked to attentional, behavioral, and emotional challenges as reported by the parents. Interestingly, when they talked to the youth themselves, they found kind of a different picture. So they actually, when we looked at the older children, so the teenagers that they spoke with, they didn't report anything across all three of those measures, even though their parents, when asked the same questions, found some of the same harms, but to a lesser extent than with the younger children. And what's really fascinating to me, because one of the things that I study in terms of nature and mental health is whether there are different benefits for people with pre-existing mental health conditions. And what we found is actually that nature has more benefits often for people who have underlying mental health conditions. Here, they found that that month of lockdown actually seemed to have some emotional benefits for children with special educational needs. And so I think probably a whole nother conversation about what that means about how our school systems and societies are serving those children. But I think that it's a really good reminder that, first of all, populations aren't a monolith, so it's really important that we think about children and youth separately from the rest of the residents of a city. But also, even within that people have individual responses. There has been some data just coming out in the past few days about the impacts across Victoria. There was a report from the Director of Emergency Medicine at the Royal Children's Hospital who found a 40% increase in admissions for mental health conditions among children and youth across the past 6 months. So that's a bit broader than the lockdown. And interestingly, the Victorian Agency for Health Information looked just at the tail end of lockdown, September and October, and they actually found a 3/4 higher rate of admission for serious self-harm and suicidal ideation in that period compared to the same period a year before. So I think it's clear, and people obviously know from their own circumstances as well, that this situation can have very damaging impacts on mental health. But I think what's great is the way that cities have been responding to the challenge. And so there's two movements that I think have really grown up. They predate COVID-19, but they have really gotten a lot more attention. The first is the Open Streets movement, and that's really about, again, shifting space in cities from cars to people. And advocates for these policies had been kind of, leaning against the window, shouting into the wilderness, whatever phrase you want to use, for a long time. But because of the need for physical distancing in the wake of COVID-19, a lot of these ideas have actually started to take root. So one of the places that they're really responding in that way is in the UK. And back in June, they announced a $2 billion investment in safer cycling and walking schemes. And just a few days ago, the Transport Secretary actually announced an additional $175 million, focused even at a more granular level than cities, so specifically for neighborhood councils. And part of that is about creating what are called low traffic neighborhoods, or LTNs. Sometimes they just go straight to LTNs, and I have to remember because it has some other meanings in medical contexts. So those are really allowing kids to return to the life that maybe the grandma might have had in that Irish example, where they're able to play and mingle with their friends. And we know that play is really important for childhood development, and particularly play in natural areas has been linked to a range of emotional and developmental benefits, and also to people's lifelong nature connection, which is really critical when we think about the need to respond to climate change. And so obviously not everyone's street is green, and those don't necessarily coincide. But the mayor of London, Sadiq Khan, has actually, before the pandemic in January, announced a huge investment into tree planting programs, community gardens, and greening schoolyards. So at least in that context of London, there should be some overlap. I think that the last area I really want to focus on is the way that the educational community has responded. And there was a call from the American Academy of Pediatrics to allow schools to conduct as many activities as possible outdoors because we know that rates of COVID transmission are much lower outdoors. And so they focus specifically on the highest risk activities. So lunchtime, PE, physical education, or any kind of physical activity, and then things like drama or chorus, where people are very tend to speak louder and mingle more. And they really recommended that schools look beyond their own schoolyards to do that. And New York City really ran with that idea. So they have a new program called the Outdoor Learning Initiative, and 60% of the city schools are actually participating in it. And they are moving not just into their playgrounds, but also into neighboring areas like nearby parks. Opening room in parks has also been really important. So a lot of cities at the beginning closed down parks to vehicle traffic. Where I received my PhD training in Vancouver, they blocked all streets in the kind of jewel of the crown of their parks of Stanley Park for a brief period of time. And actually there's been a battle to maintain it, but unfortunately they've reopened most of those streets. And I think that's really kind of a good way to wrap up and think about the connection between these responses to COVID-19 and kind of the broader urban planning and public health intersection. So Patrick mentioned the 20-minute city. People use different amounts of time. I think maybe in places like North America and here where we have more space, we often call it the 20-minute city. Across a lot of Europe, they call it the 15-minute city. And it was actually first put forward by a Sorbonne professor named Carlos Moreno, but it's actually been adopted by the mayor of Paris as a real goal. And it basically says that everything that every resident of the city needs should be within a 15-minute walk of their home. And you know what that means will be really different when we look across the lifespan. So an older person who might have mobility limitations versus a person in middle age versus a mom with a stroller or a little kid, that what the 15-minute city means to them will both be different in terms of how far that lets them travel, but also in terms of what types of supports they need there. So I really hope that these ideas that have been enacted in response to COVID-19 take root and really get more firmly embedded in municipal planning and policy. I think it's possible to achieve that vision of the 15-minute city, and it would have benefits for environmental sustainability, for public health, for all of these areas that maybe haven't necessarily been working together historically. But I think if there could be any legacy of this that would be a positive, it would be that we see that beautiful image of people being able to meet all of their needs without having to contribute to greenhouse gas emissions, and making sure that it's adapted for every resident of a city. I think it will become a reality.
Wow, it sounds a bit like a paradise. I'd love to see what a 15-minute city would look like in Sydney. Thank you so much, Emily. That was really interesting. And you mentioned at the beginning that your work is around the natural world as well. And I think I've been finding among my sort of friendship groups that, you know, so many of us are making the effort to go out on walks more and feeling like we're more tied to our desks working from home than if we were at the office, which is a funny thing to think, since I don't think it's changed that much. I'm always at a desk.
Yeah.
But what does that look like in your research? What have you found about the connection to the natural world during lockdown and during the pandemic?
Yeah, so my research, I'm involved with a project through the Matilda Center now called Alone Together, and we do have a module that asks about natural views, time spent in nature, whether you have access to your own private garden or some other form of green space, but we actually haven't begun even collecting the data yet, so I can't really speak to that. There has been some other research that's looked at really interesting interventions, like just adding more greenery to people's balconies or patio spaces, and found benefits. Most of the benefits we see are to things like mood and attention from those very kind of near by small scale interventions. But in the research that I did in Vancouver, we actually looked at access to nature much more broadly. And what we found was that particularly access to public nature did have benefits for people's mental health, but only via enhanced social interaction.
Right.
So we didn't really see any direct effects of all of these different forms of nature we looked at. So having a park nearby within how that city defines a 10-minute walk, or having more street trees, although street trees actually did have the largest impact of all of the forms of nature that we looked at. But really what we saw taking place was that all of these forms of nature, of public neighborhood nature, increased people's sense of community belonging. And that in turn had huge benefits for their mental health. We looked at major depressive disorder, psychological distress, and overall well-being, and really found these clear effects across the board. So I think that we know in non-pandemic times how important nature is for mental health across the lifespan. And I think your kind of intuition about the roles that it might play in times of increased stress is supported by some really old research. So there's a woman named Frances Kuo who looked at public housing projects actually in Chicago many, many years ago, and found that they compared different public buildings that differed only in the amounts of nature, and found that people, again, were more socially interactive where there was more nature, and also reported lower levels of stress. So I think I really encourage people to get out and embrace nature as much as they can. And if they have maybe restrictions that keep them from doing that, especially for all the people who are going back into lockdown, there was that really interesting little study that just showed even just adding some greenery to your balcony or indoors. They didn't do indoors, but having that in your view can help.
Yeah, yeah. And certainly a lot of my friends have suddenly got into gardening a lot, so you can see that happening quite often. And so you mentioned that one of the issues facing both urban planning and public health, particularly in challenging times, is balancing the needs of different communities. So how do we resolve that?
Yeah, I think this is one of the issues that struggle over keeping the roads closed in Stanley Park really brought out, because there's a huge community advocating for reopening the roads and talking about the ways in which that supports access. And then, of course, there was a huge community, particularly of parents, who pointed out that they were never able to really use the park with their children, particularly cycling, because the infrastructure just didn't make that safe. So I do think that we need to always balance the needs of different user groups. But I think what concerns me, for instance, in New York City right now, they're talking about closing schools again, but leaving indoor dining open. And there's this real conflict, right? So they've gotten to the point where the prevalence of COVID-19 is so high that you probably can't carry out both activities safely. But I would hope that communities, and particularly planners and policymakers and public health, could realize how important that education is for childhood development, and prioritize that over perhaps the financial implications of closing down restaurants to just do carry out, takeaway again.
And you and Patrick both work at the nexus of urban planning and public health, but in a lot of ways, these two fields are quite siloed. The Festival of Urbanism tries to bring them together. What other ways do you see that kind of relationship being strengthened?
Yeah, so I think there was a person who asked about the health in all policies or healthy policies. I think there's a number of approaches like that seek to bring the fields together, or at least to have them inform each other. The 15-minute city is also like that. It talks about all of those different benefits, even extending beyond public health and planning to things like environmental sustainability. But I think that one of the issues is, even though the data and evidence from the fields have really begun to inform each other, there aren't necessarily enough places where people are actually coming together. And I think that things like this festival show that you can come to an understanding when you're talking with another person that you can't necessarily do when they just send you a file of these are the anticipated mental health benefits from adding nature to your city. So I really hope that and I think here the onus is probably on the people with the most political power. So it's much easier for a policymaker to convene people from all of those different areas than it is for especially researchers to have that direct impact on policy.
Yeah.
So I would hope that mayors like Anne Hidalgo are really a good model for people around the world who say, if we want our cities to be healthy and sustainable and equitable, then we need people who can speak to all of those issues at the table in the room.
And yeah, obviously if we were all in person, it would be lovely for us to mingle after this and chat, but unfortunately that isn't the case, although we will now go across to the Q&A panel to see if we've got some questions in there. We've got a few. Okay.
Oh, I see what you mean now.
Really forefront. Do you think that younger kids, 6 to 10, did better or worse than older kids, 10 to 15?
So I think that the data from that one Oxford study show that they did worse. The one challenge, and I think their cutoff was actually at 10 to 15, so that's exactly what they said. But one issue is that they didn't speak with those younger children themselves. We often rely on parent self-report for particularly assessing emotions and behaviors of younger children. But it may be that the parents themselves were finding this situation quite anxiety-provoking and attention-stealing, and so they then reported those among their children. One thing that's really interesting quickly is just that we do see huge differences in terms of COVID transmission among younger children and older children. So I think that's important to keep in mind. And usually that changes around the age of 14.
Next question. Do you think kids get missed out on in planning and urban design? Interesting.
Yeah. Well, I think, just going back to that Oxford study, I think kids get missed out in even the underlying data collection. It's often hard to get research ethics boards to approve working with children. And I think, again, this is kind of a siloed issue, right? So people who work in childhood development often aren't the same people who kind of work in public health more broadly. So I think that they missed, and, I say that public health isn't often at the table, but I would say children and youth are almost never at the table. Yeah.
And should there be more open space in private unit buildings due to these 15-minute walking restrictions? I'd love more open space at my apartment. I live in an apartment and we have barely anything.
Yeah. So I think there are definitely ways that they have tried to integrate particularly natural space and particularly into high density, high rise buildings, because we know that actually that design of living is really bad again for social interaction and mental health. I thinking back to this intersection between policy and public health, the question is really what levers there are to kind of reshape interior spaces in buildings. So we do, of course, already have regulations on heating and ventilation, and even in some places the number of parking spots per resident. So I think that that would be achievable, but I don't know of anyone that's mandating a certain amount of natural space. Really quickly, another way that people have approached it is through green walls and green roofs. And those are really nice because they actually give benefits to people living outside of the building too. And we found that they did a study that carried out MRIs on people who just did a really quick look at a digital image of either a kind of wildflower green roof or a typical gray roof. And they found that even just those micro breaks really helped restore attention.
Wow.
So I think that's one way where we can help residents of a building and the broader community.
Wow. Well, they do advise looking away from the computer screen, every 20 minutes? So perhaps the bonus there is to look into a field of green.
Yeah, I think that's for eye strain.
Yep.
But yes, it would be great if you could also, or just your office plant in the corner if you had one.
Yep.
Would be a good approach.
A few more questions. Given the common reversals of activity-friendly changes implemented during COVID, are there any examples of street closures, etc., being maintained, and any comments about how these jurisdictions manage to maintain the change?
Yeah, so I think in contrast to what we saw in Vancouver, both London and New York City are actually maintaining those programs. So New York City's open streets began with just 10 kilometers in and around parks, and they're now up to 160 kilometers in surrounding neighborhoods. And as I said, that the transport minister for the UK just announced that huge investment in safe walking and cycling, including those low traffic neighborhoods. So I think they're definitely success stories. It's a bit outside of my area of research, but I'm sure someone is studying all of the many factors that allowed those places to continue with the programs, whereas a place like Vancouver ended up rolling back.
Yep. And what strategies could planners use to better connect with the views of kids? So we've already mentioned the barrier of ethics approval. What do you think there are any other ways that planners could engage with younger people?
Yeah, so a very long time ago now, I worked for the city and county of San Francisco and for the Department of Children, Youth, and Their Families, which actually just funded programs for children and youth. And we actually had a program called Youth Impact, where youth were trained to evaluate the programs themselves. And again, just thinking back to the Oxford study, we know that the way that adults perceive a program that their kids are enrolled in and the way young people actually do is quite different. So there are programs like that. I think, again, mostly targeting older children. But I think this kind of goes back to those trade-offs. And I think if we make the kind of ethical and moral decision that their perspectives do need to be integrated, then we figure out how to do it. But we need to really embrace that view first. Yeah.
We have one request for Emily to share the research about access to greenery on balconies.
Sure, I'll
so if Emily
email it to you.
We'll share that on the website. And are there any links between planning and COVID mortality rates? I don't know if that's within the scope of what you're looking at.
Oh, yeah, so I haven't looked at that. I'm sure there's research on it. Mortality has so many other factors that end up affecting the rates, particularly health system factors. So I'm sure there's someone looking at it, but it would be a more complicated study to design.
Well, I think we might wrap it up there. Thank you so much, Emily, for coming to join us. And thanks everyone in the audience for logging on and joining us for this session. There are still 1 and a bit weeks, of festival left to go, and you can book your tickets free online at the festivalofurbanism.com. And our next CPC session, incidentally, is next Tuesday, same time. So thanks everyone for joining us. Thank you so much for your questions, and we hope to see you at future sessions. Thanks a lot.